Hey guys, Dr. Christy Ennis. Today we are going to go over how to get some more mobility and strength in that hip that's giving you pain, right? Like Burgess Meredith said, someday you wake up and you realize you're not 81 anymore. So hopefully we can get you feeling back to at least 60, right? So important, like I said, mobility and strength. We can't change the actual joint, but we're going to get the exercises to build around there. So I'm going to show you with my right hip today because, yes, I have issues, and yes, that is the side that I have issues with. So if you get to a wall or your bed, which we're going to do the rest of the exercises on, I'm trying to get some gliding motion into this right hip. So I'm going to hang on with that left hand. Hand goes, or the web space goes basically on the top of that right hip, and then I'm pushing that hip in. So my legs are a little bit away. Right? You can even add a little bit of neck motion in there too. Right? Joints don't glide nearly as well when we start to have arthritis in here, and motion is lotion, so we're getting those joints to glide a little bit. If it hurts the neck, obviously take that part out, okay? The rest of these, like I said, are going to be lying right down. How wonderful is that? So you can do them right on your bed. If you want to get on the ground, you can too. I'm just going to go this way so you guys can see my right hip. So a lot of times all motion becomes limited. So we're actually going to take this towel roll, and it's a lovely white one. You're going to put it right in the joint. We're going to help to get a little bit more motion in this direction with our knee. So I'm going to keep that towel there, and I'm going to pull this hip up gently and kind of let it go, okay? So it's just that gentle little pull. Really try to get that towel right in there. This just provides a little buffer, basically, okay? A little bit of force to the joint. If you want to try to get a little bit more range of motion here too, you can take whichever hand you want, certainly, but you can get a little isometric contraction. So I can push down into my hand as my hand pushes up, and then try to come up a little bit more. So do a few in that direction, and then you'll go the other way. So hand pushes down, leg pushes up, and again, just kind of going back and forth with this here, just trying to get those muscles to do what we want them to do if we can't get that joint to do exactly what we want it to do. And then you'll notice, hopefully, that you actually will have a little bit more range of motion without that pinching, okay? Second one's going to be in this position too. You're going to keep your leg right where it is, and you're just going to add a little bit of rotation. Notice I don't go far in either direction. Use pain as a guideline here. This is not supposed to hurt you, okay? So we're just going till we go, oh, okay, I feel that a little bit. And again, motion is lotion. It may be kind of going a little bit, but we'll hopefully try to get that better as we go. All right, so we got the glide, the knee in, and then once that knee is in, we're adding a little rotation to it too. From there, you're going to go onto your side. And I'm going to swing around so you guys can see me here. We're going to get rid of this towel. As lovely as it is, I'm going to take out that mic too. Okay, you're going to bend both of those knees. Heels are going to go together. I'm going to be pretty straight in one straight line as I do this. Now we're going to lift that top knee up. So we're working on strength through this side butt muscle as well as range of motion into rotation. So there's 3. We'll get 10, okay? 4, 5, 6, 7. Feel free certainly to do these on both sides. 2 more. Sometimes you actually can get a little overflow from the other side. The side that moves well helps the side that doesn't move well, actually. All right, so get the opposite motion. Knees are going to come together, and then I'm going to lift that top leg up for 1, 2, 3. Working on everything that's limited. 4, 5, 6, 7, 8, 9, and 10. Now, I'm going to keep these legs bent, but I'm going to lift this whole top leg up. Whew, and then I'm going to add a little rotation that way, and I'm going to rotate down. Now, notice, obviously, my range of motion is a little bit limited. I'm trying not to move too much with that top leg, just getting that lower leg to rotate. That gets the rotation in through the hip. And boy, oh boy, is that working right now. Again, use pain as a guideline. Please don't make any of these hurt. Some of these may not feel great, so skip them, and that's totally okay. Yep. And I actually am getting a tiny bit more range of motion as I go. You can tell that I was definitely tight to begin with here. Good. Okay, one last exercise. You're going to go on your back, And again, range of motion and strength here. You guys have probably seen me do this one before. Love the bridge. Hands down, squeeze into those buns, and you're going to lift up. So we're actually stretching in through here, but using those glutes at the same time to help support. So here's 2, 3. Don't go up so high that you arch your back. 4, 5, but engaging the glutes actually loosens the hip flexors. 6, 7, 8, 9, one more, 10. Awesome job today, guys. If you like this information, please subscribe and stay tuned for more.